So I'm going to be discussing the criteria for the AP knee image. First, you want to make sure that you have a marker in your image. You want to make sure that all the anatomy is shown. And that includes the patella superimposed over the femur, the lateral and medial condyles and epicondyles, the medial and lateral tibial plateaus, and the intercondylar eminence. You want to check for no rotation, and you check that by the patellar superimposition and the eminence. You're also going to be able to see the fibular head. You can see that the knee is fully extended and that there is an open joint space. Next, I'm going to be discussing the criteria for the AP medial oblique image. As always, you want to make sure that there's a marker in that image. And the anatomy that you're going to see in the medial oblique view is the same anatomy that you'll see in the AP image, except you'll see the patella is on the medial aspect of the femur. You'll be able to see an open tibiofibular joint space and the lateral femoral and tibial condyles. Next, we're going to discuss the lateral knee image. So you want to have a marker in your image. Unlike this one, there's no marker shown. Then you want to check for the femoral condyle superimposition over each other. And in this image, you can see that they're not superimposed. You're going to look for the patella in a lateral profile and the knee being flexed 20 to 30 degrees. You want the knee to be in a true lateral position. This one you can tell is not, and you can tell that by the superimposition of the condyles. You also want to see an open patellofemoral joint space and an open joint space between the tibia and the femur. The next image is the intercondylar fossa, or also known as the tunnel view. You would want to see a marker in your image. As you can see, this one doesn't have one, but what you're looking for is a elongated fossa, the intercondylar eminence and tubercles, the patella superimposed over the femur, and that there's no rotation in the image. The last image that we're going to go over is the tangential patella, also known as the sunrise view. So you'd want to have a marker in your image, unlike this one. You're going to look for the patella in profile. You're also going to check to make sure that the patellofemoral joint space is open all the way. And you also don't want it to be superimposed over the femur. So that's the criteria for the 5-view knee x-ray. Bye.